Well, number one, life will continue. Men somehow think that there's going to be this radical change in their lives and they won't be able to do anything they enjoy and life is ruined. Now, of course, anything is possible with any treatment, but that is unusual with androgen withdrawal therapy for prostate cancer. There can be some changes to prepare for, but generally life continues. The second thing that I think men need to know are the common side effects that can accompany androgen withdrawal therapy, and just have some idea of how to manage those. The two most common are hot flushes and sweating, very like what some women will describe during menopause or change of life. So something like 85% of men receiving androgen withdrawal therapy will experience those. It's annoying in, I would say, about 25% of men, so people need to know that it's not everybody by any means, it's a minority, but they also need to know there are things I can offer them that can help. Including stopping the hormone therapy if we just, it's unpleasant and we aren't finding anything successful to deal with it, but that's rarely required. So the other common side effect is an increase in the middle age spread, so a little bit more abdomen spilling over the belt. That's common. Men don't like it, having to let their belt out a couple of notches. So I tell people about that. I tell them that it may be hard to get rid of, certainly while they're getting the androgen withdrawal therapy, and even it may take a while afterward, but that they can keep it to a minimum for sure by exercise. And exercise is good for lots of things, but it can help with that too. So those are the two things that they need to know, perhaps the most. And also knowing about the effect that the androgen withdrawal therapy can have on sexual functioning. So knowing about that and knowing the measures that can be made available. And also knowing that they're free to tell me they want to stop at any time. It's not a commitment they're making that's binding or anything like that. And the last thing is just a little bit about some of the other measures that we will do as a routine in many men receiving androgen withdrawal therapy. So we do monitor bone health. The reason for that is if men are receiving, a reasonable length of time worth of hormone therapy, so say more than 6 months, there is some risk of thinning of the bones, a condition we call osteoporosis. And that's a condition most people think of as occurring in women, but it can occur in up to 35% of men who are 70 or older. And one of the risk factors for that, not the only one by any means, but one of the risk factors for that can be hormone therapy for prostate cancer. So we monitor for that. So the routine is we monitor the bone density with a test called a bone density test. To start with, at around the time they're starting the hormone therapy, and then every 3 years after that. We also recommend exercise. This is a theme, because that helps keep the bone strong. And we also, at a minimum, recommend that people take a vitamin D and calcium supplement, which we believe helps keeps the bone strong. So we tell people that we believe that's something they need to know, because that's something that's in their control to avoid the osteoporosis for most men.